I think we are live now, Dana. How
Oh,
are you?
wow. Hi. I haven't
Nice
seen
to
you in a
see you.
while.
I know. I miss you so much. It's been over a year since we've seen each other in person.
It's
It's
terrible.
crazy. Yeah.
It's actually quite terrible. But we're kind of making some inching back some plans, right? For
Well, you're making itching back plans. I'm planning to stay here in my
yeah,
rabbit hole.
exactly. We're making plans to see each other. We're making plans to see
Yeah.
each other.
Yeah.
We're starting to it's starting to percolate a new world.
hmm Okay. So we have some followers starting to see us now. So hi, everybody.
Hi
Thanks for joining.
everyone.
Okay. That's great. So today we're going to talk about some new terminology that neither one of us likes, what they're trying to label as a post-COVID syndrome.
Hmm.
Dana, this is, your kind of pet peeve. If you
Yeah,
want to talk about it, we can start.
it's both of our pet peeves. Well,
I know.
I
You get
heard
fired up.
yeah, I'm always fired up. We're yin and yang. I was dismayed and horrified and not surprised, actually, neither were you, to hear about this new post-acute sequela COVID syndrome situation that the NIH or that Tony Fauci named long haul COVID. This was sort of one of our main concerns because this is what happened in Lyme disease, and this is where things went really haywire when chronic infections began to be called post-treatment Lyme disease syndrome, implying the infection is over and adequately treated, and it left thousands and thousands, if not hundreds of thousands of people suffering. And by the wayside, I think there's so much evidence now that COVID is chronic in a certain percentage of people, not everyone. There's definitely damage. There's other stuff going on. But for the ones who have a chronic infection and ongoing persistent infection, I was reading today another article about how it stays in the brain, and a lot of people have neurologic symptoms. What do you think?
I'm also saying what other symptoms, what latent infections is it stirring up? I'm also hearing from people that, have long COVID that say that they were diagnosed with Lyme, Bartonella, and others after having had COVID. And could that be part of the problem as to why they're still sick? Like, did it flare it up? Because before COVID came along, I was seeing a similar thing when people get a bad bout of influenza or Epstein-Barr or even dengue fever. Mm-hmm. How many people have come in with a diagnosis of chronic fatigue syndrome, ME/CFS, after a bad viral illness? I literally can't count. And I've gotten most of these people better over the years, and they turn out to have a mix of infections, not just one. Chronic fatigue syndrome is such an interesting diagnosis because it's so heterogeneous. It's really a broad spectrum. Like some people come in and they're fully functional, and other people have been in bed for 10 years and they get the same label, and it just doesn't cut it. But I do think that there's evidence of a chronic infection with a parentheses and an S, chronic infections or chronic infection in long COVID. It makes the most sense, especially when you have people with these latency periods when they feel fine for a while, then they start to get sick again. I mean, that doesn't seem like, persistent damage. But they're very much kind of corralling people into the same kind of, little box where you get stuck with the ME/CFS diagnosis. And look what happened to that community for so many years when it's been gone nowhere, and I think I'm getting the feeling that younger ME/CFS patients are being kind of convinced that they have a genetic disorder or they have just something that can never be fixed and it's always be a mystery. And, it's hard to kind of change this mindset when it's, Amanda Hernandez says, just like PTLDS. Exactly. Just like PTLDS.
Exactly. Yeah. And I like that you mentioned, I think a lot of people don't know this. Sometimes when you get Lyme and sometimes when you get COVID, you get the initial infection. And you might not feel that horrible. You might have a flu-like syndrome with either of them. That's like, there's so much overlap, right? And then it resolves. And then 3 months later, 3 weeks later, 6 months later, in some cases, all hell breaks loose. That's when, when Dr. Phillips is talking about a latency period, there is this long stretch sometimes where you feel fine. And then what are all these new symptoms? You can't convince me. I mean, with Lyme, I had 3 months before I got really sick from it. I mean, I got the flu-like thing. It went away with antibiotics and whatever time. And then I was fine for 3 months. I'm hearing the same thing for COVID patients. And it alarms me because it informs the treatment that they should be getting.
Or at least the studies. I mean, it informs the study designs. Just the other day, somebody asked me, what can I do simply if a doctor won't give me anything? And, they have these studies with vitamin D where they give vitamin D to patients upon entry to the hospital,
Yeah.
and their risk of requiring ICU is 25 times lower just from vitamin D. And in the vitamin D group, nobody died. And in the standard of care group, 2 people died. So there wasn't a big enough study to show that that part was statistically significant, but the 25 times less ICU admission is like a huge difference. It was really statistically significant.
Yeah.
And if a drug company had a drug that works as well as vitamin D does for COVID, you'd see a commercial about it every 2 seconds on TV. And
it wouldn't have new and worsening heart failure.
right, it wouldn't have leukemia as a side effect.
Exactly.
Yeah.
Thank you.
But no one talks about it. Like, you don't see it. Of course, you don't ever see it on television. But people should know also there is such a thing as too much vitamin D. I just had a patient the other day, a very nice lady who's been taking a lot of vitamin D. First time I'd seen her, I did her, intake baseline blood test, and her vitamin D levels were actually sky high. It could be toxic too much. So
what's the best level? Sorry,
55 to 60 is
Okay.
the best. And that's actually the sweet spot, not just for COVID, but also for heart disease and cognitive function and cancers and other pulmonary diseases. It's been long established. There's been really so many studies on the topic. Vitamin D is a very, very cool thing because people think of it, oh, it's just a vitamin. It's really a hormone, and it behaves in very unusual ways. And too much is bad, and not enough is also bad. So I want to put up some of the comments that are so nice. Michelle Trusser is saying, thank you so much for the incredible book. We're so glad that it's helping people, which is the point. That I'm getting, Dana, you heard a message, we played it for you. We're getting people who are not my patients calling the office with these beautiful messages of, thank you, your book, changed my life in this way or that way. And, why do we write the book? It's not really so much about sales. It's really to help, this is a labor of love. It took years and years and years. And, I'm just glad it's helping people.
Yeah. That message was absolutely incredible. And we read all of your message. I know when you guys post comments, and I don't know if you know, we read them all and we talk about them so much, and we're so appreciative of them. So thank you. It means everything to us, especially, it's kind of like when you make a record, right? When you're a singer and songwriter like I am, and you make a record and you're sort of in the studio for a year or 8 months, you have no idea if anything you're doing is going to resonate. You don't know if it's good. You're in like a little tiny circle of people who have, an opinion, but that doesn't necessarily translate. So for us, this was a similar process, and it's been very gratifying to hear from you. You're looking at comments. I can see. Here we go. I know the distracted face. He's like, so I'm going to talk about Lucy for a minute, if that's okay.
Okay, sure, absolutely, yeah.
You seem busy, so I'll talk about my.
Because we have to set it up where you can read it, so you have to do the multitasking, and I could just smile and look pretty. Because it's so hard for me. I don't know what I'm doing.
That's
my eyes are terrible.
Like
I'm the one who wears the glasses, and I'm reading the comments, and
And you're so pensive about it. It's like
because I can't multitask very well. That's why I'm pensive, because I'm looking at they've done studies. People pretend to be able to multitask. Everyone says I'm a great multitasker. I've learned that I like to single task. That's my jam.
I like you to single task, and I can't get you to do it. We're on the phone, and he's like, so tell me about this or that. I'm telling him in silence. I'm like, are you there? He's like, yeah, I'm just.
It's time constraints.
My fireplace guy is supposed to come today. That's basically what happens.
So I haven't used my fireplace in years, but what an interesting, funny little story. When I was with a patient, I had an old, not an old, but a former administrative assistant who interrupted me with a very, very complicated patient a long time ago. She's like, I'm sorry, Dr. Phillips. Dr. Soot is on the phone. He'd really like to speak with you. And Dr. Soot was the name of the fireplace, the chimney cleaner at the time. She thought it was just a little. That's
a very Larry David moment.
It was very Larry David.
I like it.
We have a lot of Larry David moments in my office. But I can't. You want to hear some of the comments? They're great comments coming in.
I want to hear them.
Amazing.
I'm just sitting here. I can't see anything. I'm just looking at you in the book.
Excuse me. People are. I'm not sure what this is the context of. So Amy Pfeiffer Epps. I'm sorry if I pronounced your name wrong. Is saying how long to stay on Plaquenil, hydroxychloroquine if stop chest pain returns on ivermectin 2. I don't know if this is in the context of long COVID, but excuse me, when patients, hydroxychloroquine has been so demonized for COVID, but some doctors are still thinking that it works. And I'm kind of one of them. But when I was using it earlier on, I don't use it as much now because it's been vilified so terribly. But I was using it last winter. I was having people on it stay on it for 10 days rather than 5. And I think that 5 days is actually too short.
Yeah.
But in terms of ivermectin, I have patients, most of the patients for an acute situation with COVID have resolved rather quickly. So within 24 to 48 hours, I've started feeling better on it. And I've had patients, there's some data showing that 5 days is better than 1 day. And, people have to judge by how they're feeling too. I always ask this, the first question I ask if somebody I'm considering ivermectin is, have you been to Africa? Just to rule out this rare parasite called Loa Loa, that if people take it and they have a Loa Loa and they take ivermectin, they can get a type of a parasitic Herxheimer called a Mazzotti reaction, which can be very dangerous. So that's my first question. If people have been to an area of the world where there's Loa Loa, which are a few countries in Africa. And here's another question here. Talk about vitamin D. It says in your book, you state that tuberculosis, hypertension, and stomach ulcers were once considered stress-induced. You then go on to explain that infections behind TB and stomach ulcers. What infection underlies? The infection behind stomach ulcers is H. pylori. It's a spiral-shaped bacteria that this team from Australia, they tried to present their data in the early 80s. They were laughed off the stage. And then another couple of doctors from separate institutions, for actually Harvard and Cornell, found the link to stomach bacteria a full 40 years earlier, and they were ridiculed so much that they couldn't present their data. So people think, oh, medicine is just this big happy place and innovative science gets embraced and kumbaya, and it's not the case at all. It's like you have a good idea, you want to tell people about it, and you get ridiculed, and that's what happens routinely. And everybody thinks that their version of the truth is the truth, and everybody can't be right. In terms of what underlies TB, TB is the infection. So tuberculosis is called Mycobacteria tuberculosis. That's the bacteria that causes TB. Okay. So Dana, tell everybody about Lucy, because this is I'm glad you figured everything out. And she's a great dog, and it's important because other people are going to have this problem, and other people don't know about it. So let's hear.
Thanks. So I have my dog here. She's a 12-year-old Tibetan Terrier, stray, from Puerto Rico, and she, we moved from New York City here, and New York City doesn't have a lot of. I lived near a little park, but mostly you're not like in the grass in that park. So she hasn't been exposed to a ton of chemicals, but a couple of times she has been exposed to permethrin, and which is a tick and flea. It's not even a repellent; it's an insecticide, isn't it? To be specific?
Yes, yes, okay. It is. It's an insecticide. It's not just repellent.
Okay, so it's a little bit different. But anyway, these it's actually, I think, in Frontline and Avantix, which are the topical flea and tick things for dogs. And she's had severe neurologic reactions to both of them. So the vet said I can't give them to her anymore. And then in March, I had her in a permethrin-infused bandana because we were upstate and there were a lot of ticks. And she had very severe neurologic reaction, tremors, looked like she was going to have a seizure. She was hiding. She didn't know her name. Had to rush her to the animal hospital in the middle of the night. Had to wake Mary Beth Pfeiffer, that's a whole other story, to find out where to go in the middle of nowhere. I had no idea where I was. And she had to be in the hospital for 2 days.
So just to clarify, was that did you say permethrin or permethrin?
Permethrin.
It was, what was it?
It was a permethrin infused.
Okay, there's a permethrin. Got it.
Okay. So then we moved to California, and I noticed a couple of times she seems like really tired, but I don't really know why. And I don't know anything about all the chemicals they put in the ground here. I haven't given it a lot of thought. And for the last they sprayed this chemical. They gave a warning with signs called Diquat, D-I-Q-U-A-T, on the common spaces here around the pretty flowers and bushes and stuff. And they say, it's safe for dogs after 24 hours. Well, I know better. Lucy needs, if a regular dog needs 24 hours, she needs a week. So I literally wait an entire week to walk her here. She starts having these weird, slow-moving neurologic symptoms till they progressed, till she stopped responding to her name. She threw up. She started having tremors. Her leg was like myoclonic, just jerking motion that wouldn't stop. And I took her to the vet. I was extreme. I've never actually seen her not respond to her name and just lay there flat like she's dying. And I take her to the vet. I don't know exactly what's going on. I haven't put it together yet. And the vet scans her abdomen. And I'm describing a neurologic reaction, right? No, she doesn't pick up on it. And then I take her home. Things are still kind of bad. And I noticed that right after a walk, she licked the bottom of her paw and started shaking. And I was like, she walked through, there's something in the grass. So put together that it was a toxin, took her to a dog neurologist. He agreed. It's really not that much you can do at that point. You can give her, for me, they recommended NAC, and she's getting better. But now it's this horrific, like hypervigilant situation with walking her. She has to be in boots, or she has to be washed with soap because it can't just be water because it won't dissolve the chemicals. I'm not 100% even sure what it is, but it's something that is something. Right.
Yeah, I mean, but the take-home message is awareness, because your vet didn't pick up on it. The vet referred Lucy to a neurologist, and and you brought it up. You said, "Could it be a toxin?" And she's like, "No, I don't think so."
She said no, and you were the one who said that it was dumb because she said that because you said because I told her like it was waxing and waning. And she's like, "Well, that wouldn't be consistent with the toxin." And you were like,
"Yes, it would. Yes, it would." Because the question you were that she was getting, early dementia, and I was like, dementia doesn't usually wax and wane, but I want to check with the vet to see if that can happen with animals, initially. But it does bring us to a tangential. So number one, people should be aware. I know this is not a veterinary, program here, but people should just be aware, because we have a friend who's a doctor, and two of her dogs died suddenly.
Yes.
Right? And it's a crazy story, and doctors are aware of things. Doctors are aware of toxic exposures.
Her dogs were poisoned.
It still happened. Yeah. So if your dog's behaving strange, obviously we think about infectious causes, but we have to think of toxic causes too. And I just want to talk about this weird thing that I don't know if we talked about before, but it is an area of interest. It's in the book. It's kind of spooky a little bit.
Okay.
And this very high rate of neurodegenerative illness that was in Guam, it was like 100 times higher than all around the world. And it was a combination of ALS and Parkinson's and a little bit of Alzheimer's all mixed together. And they linked it to that people were eating this fruit bat, and the bat was eating these seeds, and in the seeds was a concentrated toxin from cyanobacteria, which is the type of bacteria that is a misnomer. They call it blue-green algae, but it's really a bacteria.
Huh.
And it makes this toxin, and it accumulates in the brains. And they showed in animal studies, when they fed them this toxin, they get these characteristic neurodegenerative changes. And then there's a readily available chemical called L-serine that can displace the toxin and render it kind of inert. And that's the antidote for that. But researchers looked at blooms around the country where they've had this so-called blue-green algae, again, which is really a bacteria, and tied it to clusters of things like Alzheimer's. So the book takes a big emphasis on the infectious causes of chronic illness, but we do touch on the toxic causes as well. And, it is a subject to be elaborated on, because it's not the focus of the book, but it's something we have to look at as well. It's not just infections.
And I think you're right. There is for me watching Lucy, who has had Lyme before, remember one time she went to New Jersey to see my mom, and she couldn't walk 11 days later at all. Her front leg was totally, it wasn't working. So at $1,400 later, every single test in the book, they don't even think about Lyme. I said, I think about Lyme. I think she probably has Lyme. So anyway, I gave her my own antibiotics and got her better. And there's a huge overlap between all of these things. The symptoms of infections, the symptoms of toxins. It's very hard to separate it. And I don't ever want to just think about one thing. I want to make sure that the thinking is broad and we're thinking about everything. Okay, tell me some questions. Do we have questions
we have so many questions, and I'm sorry if I skip anyone, but this is what happens,
we have an hour, so let's whip through as many. I know people are having questions about the book, and I think we should whip through some. Now, you're reading so much, you're not even telling me any questions.
This is my jam.
Okay.
So no, there's a question here about neurofibromatosis, and it's kind of a complex question. Yeah. And it's a question of, can it be from Bartonella or Babesia? This is not something I typically see. I have seen patients with, conditions that look overlapping to this, but I wouldn't be able to say, hey, that's an infectious thing. So I would say that it has to be followed up on closely. I'm sorry to punt on this one, but I would definitely want someone like this to follow up, please, with a good neurologist. And and make sure we have the correct diagnosis. But sometimes, because I've seen nodular appearing MRI findings of, different parts of the body, including parts of the brain and nerve roots, where like, what is it? Does it look like cancer? Almost like I have seen weird, confusing pictures where it turns out to have been infection, but I would never default to the infection thing when something is weird and confusing. And if you know what I'm saying, like if you're on the fence, even though so much turns out to be Lyme and these other infections, so much turns out to be Lyme plus, as we call it, I would always default to ruling out everything else. Yeah. That's the criticism of doctors like myself, is like, oh, you think everything is Lyme. I am constantly trying to think that it's not. I am actively trying to rule out the other things before because I don't want to be in the default position of always going there. Okay. It turns out that it does cause a great deal. Hi, Lorelei. Nice to see you. Lorelei, always very nice to put a nice message on there. And we have some really great people that are saying hello. It's Jill.
Hi, Jill.
And Michelle, I put up already. And it's a nice comment from Eleanor. And it's just some nice things people are saying.
That's so nice to see. Thank you, Eleanor.
And we talked about H. pylori. Somebody said that they couldn't find it on Amazon. That's so odd. Where can I buy the book? I just looked and couldn't find it on Amazon. Yeah, it's there. It's on Amazon, Barnes & Noble, Indie Books,
Target,
Porchlight, Target, Walmart. It's there. Just search maybe chronic and then our names, Phillips and Parrish, and it should definitely pop up.
Definitely.
And whoops. Oh, sorry. Here we go. Can you take ivermectin if you have chronic Lyme and get COVID? I take 5,000 units of vitamin D and zinc. So again, not giving specific medical advice to any person. People have to understand that. That's not what this program is about. It's just I can give general, things when these topics come up. And the answer is yes. Most people can take ivermectin with persistent, Lyme plus symptoms. There's two caveats that I see mainly with ivermectin. One is that if someone's been to Africa, you got to rule them out for this rare parasite called Loa Loa. And the other one, Dana's like, yes, Steve, Loa Loa.
We already talked about that.
Because almost no one has Loa Loa, but I'm like obsessing about Loa Loa. I know that's the one. Okay, that's one. Just give me my obsession. I have my shtick, and that's that one. And the other thing is ivermectin performs as an immune potentiator. Immune potentiators are interesting because they can make people, their immune systems really stir up and flare up when there's an infection to be fought. And it doesn't do much when there's no infection to be fought. So I'm a perfect example of that. So when I was very, very sick with Bartonella, and it was actually 2 weeks before I was supposed to close my practice, and I've told this story before on different interviews, that I was given ivermectin at a really high dose. And at day 4, I had to be carried out of the office and my back completely seized up. And I was all happy. I thought it was, yay, Herxheimer, I didn't know exactly how it was working. And it just didn't stop. And I stayed on a very high dose of ivermectin. A doctor offered me ivermectin. And at that point, I was so sick. I always say, if you, would have given me dog poop, I would have said, sure, And I would have taken basically anything to try and get better. And so I tried everything. And it was one of the many things that I tried. And it was a really horrible experience for me. And then fast forward a year and a half, when I was so much better, I said, ivermectin was a mystery. That drug flared me up for 4 months. I don't understand it. I want to revisit it. I'm so much better. Maybe I can tolerate the flare. Not only did I not flare up, I felt immediately fantastic and wonderful. So what is going on? It's like a different drug, but it's the same drug. It's just that when you're behind the 8 ball, you have a lot of infection going on. If you have something to strengthen the immune response, you can actually flare up the symptoms very much, because these illnesses are caused by, in large part, the immune system going after the organisms. So it's a double-edged sword. And that's what I think happened. And there's evidence that ivermectin works in this way to reduce immune dysfunction, which is a good thing generally. But if you have a very high infectious disease burden, it can really flare people up. And then when I was a lot better and I didn't have much infection, it just made me feel that much better. So,
I've taken it a million times and I've had no problem. I should say nobody that I personally know that's taken it has had any problem, except you. You always have to be special.
Right. No, I've had a few. I have a very few. Most actually feel better on it, not worse. Yeah. That's my experience. Most do not flare up in the way that I flare up. But I was very, very crazy sick.
Right.
It's really ironic that I was sicker than my average patient, like a lot sicker than my average patient, but I was. And do you recommend ivermectin as a preventative for chronic Lyme patients? Preventative for for COVID? I'm assuming preventative for COVID, people with persistent Lyme. I have some patients who say, look, we can use it as an immunopotentiator
Mm.
for the underlying illness, whether we can call it Lyme plus, whatever they have, and also for COVID prophylaxis until these vaccines and potential herd immunity and the whole thing is, until we have a better situation. So there's some data that once weekly ivermectin has a very high rate of preventing healthcare workers from South America. Excuse me, they did a study. I think it was nearly 100%. And there was a prior study that 2 doses of ivermectin in 1 week, and then they no ivermectin for the following month, prevented people from getting COVID. It was more than 80% effective.
Wow.
So,
Yeah.
so I have some patients on that.
Do we have any book questions?
There's a chronic fatigue syndrome question. Here, we put
Cool.
this up.
Great.
Okay, I'm just starting the book, and I was diagnosed with CFS years ago, and I still don't know what I have. Hello, Diana. Much better now, but still have symptoms. Look forward to learning more. So more a comment rather than a question. I wish you good luck with everything. Obviously, if people have questions, we'll be doing these videos on a regular basis, and everyone can locate their questions around.
When you see CFS in your practice related to infection, how much? Tons, right?
Yes, I've been seeing years and years and years. I have like 80%, good response rate. It's a little bit lower response rate than fibromyalgia patients. Fibromyalgia and CFS overlap, just like everything overlaps. But
I think it's important for people to hear that because CFS patients are often told there's nothing they can do. And that's not necessarily true, and that there's no cause, and that's not true either.
Yeah. So this is a question which actually speaks to the core of the book. It's a long question. So now we just see our noses with this question. Could another way of looking at autoimmunity be that the immune system is attacking our own cells that have been infected with intracellular bacteria, or perhaps the antigen testing is actually mistaking the protein of the invader as the autoantibody because of the similarities? I think that it's unlikely that that antigen testing is mistaking autoantibodies. That's not usually a thing that we would see, but it's very likely that part of the autoimmune kind of conundrum is from chronic bacterial infections. Intracellular is usually the hallmark of chronic bacterial infections. They kind of have to be intracellular.
Okay.
And okay, so there are quite a lot of questions. This is what we go through all the time. But what happens is when I put a question up, Dana, it's and everybody else, it kind of scrolls down very quickly, and then I lose track of where it was before, and that's why I'm just scanning this. So I'm sorry. Okay, and now I'm more toward the beginning, and I don't
think we need to even just go on. I mean, we're not going to have time to do more than 10 questions. So
right. Okay, I'll just pick a question that just jumps out at me. Okay, here's something about education. So spoke to a director of mental health services today in Vermont. She's wanting to get education to people inside our healthcare system. I wanted to do a book club. And basically read this book to folks. Well, that's great. I mean, these are great ideas, and this is kind of our thing. Like, how do you spread this kind of message that chronic infections are a major cause of chronic and autoimmune illness? Things like book clubs are important. Dana, would you be? I'd certainly be. I know I could speak for both of us. We'd be willing to do book clubs for communities that are interested in looking into this topic. I mean,
we'd be happy to come and do a special, Q&A or two when people are done with the book and have questions. It would be our pleasure.
Yeah, I think it's like a grassroots kind of an effort that's very important. Like people have just done that on their own. They've tweeted with pictures of the book. Everyone's been so nice,
Yeah.
And I think that it's word of mouth. Like when people said, "How did you, start your practice? Did you advertise?" I just never advertised. Everything was word of mouth, and that was it. And I think that word of mouth is a very powerful thing. If people find a message in the book that they think is compelling and they like it, they're going to tell their friends. And now with social media, it's that much more easy to do. Okay, let me take a question. So, okay. Okay, here's a question about neck pain with Bartonella and inflammation. I had I couldn't turn my neck at all when I was at my sickest. I literally couldn't turn it more than this. The muscles on the sides of my neck were completely in spasm at all times. And when I started getting better, when I would drive a car, I'd have to turn my whole body around to look. It's a crazy thing. Like people that haven't gone through chronic illness don't realize how these what seem to be small things are really major things, and they can impact on safety and everything else. For me, it was the underlying, antimicrobials that ultimately helped me. But along the way, things that help me and help my patients are kind of, safe anti-inflammatories that like curcumin-based anti-inflammatories can be beneficial and easy. And there's some other herbal anti-inflammatories. We have some in the office, and also a cold laser with a class 4 laser has been really helpful for a lot of my patients with, persistent tendonitis type of a situation. Because really when people have the muscle stuff that's painful, it usually ends up being tendons, not the muscles. Actually, the insertions of the tendons is what's the, and here's a person who says that she went through the same thing with her dog. So I guess this is a more common thing that, people talk about.
It bothers me because this is covered up. I'm sorry,
Yeah. It seems I was just talking to Dana about, we were talking about this before, why it should be really easy for the dogs that died to have done toxicology studies to kind of educate and alert these companies to products that may be harmful.
A lot of times owners and vets don't recognize the cause of death. They say, oh, the dog had a seizure disorder. They never check them. So actually in this community, that's way too pretty. And when you see it's so pretty, you have to think about why is it so pretty? What are they spraying? 2 dogs died here before when they used Roundup, and then they switched to this other bad chemical, and another dog got really sick and almost died before Lucy. I posted on the local board here.
It's crazy.
Very disturbing.
It's so crazy.
Hector's dog died of lymphoma at 8, and remember a little
Of
child.
course.
Thing, and young healthy dog lymphoma. I said, oh my God, I asked Neil, why do you think Chai got lymphoma? Well, he said, well, her nose is in the chemicals all day, is in the ground. I mean, he said tons of dogs are getting cancers that they shouldn't get because of these chemicals. Nobody's thinking about this. I certainly wasn't thinking about this. I think he's an oncologist, so he was thinking.
No, because somebody just asked me the other question. So the rise, the precipitous rise of chronic and autoimmune illness is a pandemic that's been going on for the last 30 years under everybody's noses, and that's why I wrote the book. And then we find ourselves in the middle of this other like rapidly exploding pandemic, which is COVID. And now on top of that, we have another chronic illness pandemic of long COVID, superimposed upon regular COVID.
Yeah.
So, but then you say to yourself, the first pandemic, the chronic illness pandemic, why was that happening so quickly? Because the rates of the infections weren't going up that fast to account for this. They've been around forever. So is it the air that we breathe and the water and that we drink and the food that we eat and all the chemicals and stuff we get exposed to that's making it a difficult environment for our bodies to deal with these chronic infections?
I think that.
Yeah, I really don't have a doubt that that's playing a big role. Here's a nice question about, what type of blood or antigen tests are used for intestinal worms and what is the best lab? So I do, screening tests for a range of parasitic infections for patients when they come in. And we just use the local labs that take my patient's insurance. I don't actually send out to fancy labs, believe it or not. I know that's shocking. People are like, what holistic lab do you use? I'm like, none, So we just use Quest or LabCorp or the standard hospital labs. And we don't, sometimes we do stool tests.
We should clarify.
No, not for Lyme, but for the parasitic ones, I do a panel that has Toxocara and Toxoplasmosis and Strongyloides and Trichinella. And depending on travel history, I add some of the more unusual ones. We check for schistosoma. And if people have traveled far and wide, we check for a lot of them, like Leishmaniasis.
Sorry, you're in the weeds.
I'm in the weeds. Okay. So we check for a lot of parasites. And because the specific reason is that concurrent parasitic infections, even if they're not causing symptoms, can suppress the immune response. It's a well-known phenomenon. It's not actually considered at all controversial. And could that be another part of the reason that some patients are more chronically ill than others? Because they have a parasitic infection that's bringing them down. And shockingly, as it is, 1 out of 5 of my patients test positive for at least one of these parasitic infections. Wow. And we're not sending them out anyplace special. In terms of Lyme testing, I routinely use Stony Brook. as my preferred lab because they take most people's insurances and they have a sensitive test. And for Bartonella testing, I routinely use Galaxy.
We should clarify that you need to do an all bands test at Stony Brook.
Right.
It has to be all bands, or I don't think it's very useful.
Yep. Yes. And people are asking constantly, of course, about the COVID vaccine.
Mm-hmm.
And are you recommending the COVID vaccine for yourself and your patients? I'm trying to weigh the risks. And
Yeah.
obviously, I'm not going to be recommending against it. I have concerns like anyone. Sorry, this seat is it looks comfortable, but it's not. I know I've had a few people recommend get rid of that chair. I'm going to get rid of this chair. So patients are getting the COVID vaccine, and most of them, believe it or not, have not had bad outcomes, but some of them have had very crazy outcomes. I'm not going to sugarcoat. I just tell the truth as I see it, always, So I've had some patients that said they felt very, very badly after the vaccine from what appeared to be flu-like reactions. And some patients have had exacerbation of underlying symptoms related to, in one case, actually in both cases, it was Bartonella. So I have seen 2 exacerbations. One of them was subsequently they were both able to get both shots of the vaccine. But one person is much, much worse. She came to see me after 2 years of not, requiring my care, and then coming back after having flared up after the COVID vaccines. But I'm not saying that that's a reason not to get the vaccines, because COVID is really terrible too. So in the second case that I saw a bad flare, the guy was able to not tolerate the first vaccine and wind up in the emergency room. And he began treatment again for Bartonella and was able to tolerate the second vaccine much better.
Huh.
And you say, whoa, that's interesting. It is interesting. Maybe, Lyme Plus patients should look at that as a people should be asking their doctors, are they seeing the same thing? Because you don't want to look at an N of 1 and say, does treatment help, cull some of the reactions?
Yep.
But both my parents have had both vaccines. So,
they've been great.
They've been fine.
Yeah.
Yeah. And so there's someone asking about a question about hypertension. Could there be an infectious cause? Hypertension has many non-infectious causes because, we continue to grow as we get older, and we actually grow old. We literally grow old. It's the same mechanism of growth that doesn't stop. That is part of the aging process. And the walls of the vessels continue to grow thicker, and that contributes to hypertension. And so there's going to be non-infectious causes of that. And then also there can be infectious causes of hypertension and hypotension. So infections that infect the lining of blood vessels, like Bartonella has to do this, can cause swings of blood pressure. And Coxiella can do the same thing. So I have seen some patients develop, labile hyper and hypotension with some infections that has resolved with antimicrobial therapy. How long does it take to control heart palpitations with antibiotics or natural products? Most of the time, in my experience, we have them come in line if there's an infectious cause pretty quickly. The exception to that is some people seem to get like scarring of the heart. I've seen it where they get what's called reentrant tachycardias, which can be hard to treat and require ablations, and those don't respond to antibiotics every time. But for example, we've treated about 40 patients with heart failure, like late stage heart failure related to these infections, and I've never had anybody that didn't respond to therapy, which is so spectacular. I mean, knock wood, it's only 40 or so patients because it's not a common condition, but we saved, 40 of those people's lives, and that's really nice. And everyone knows that's what my dad had, and that's what Neil Spector had his heart transplant from. And, and Dana, you had some little touch of that as well. So it's a horror, but people should know that heart failure from these infections actually does respond well to treatment.
And it's sad to think how many people have heart failure and never get to the root cause and die.
Yeah, I've had this conversation with, I can't even count how many cardiologists. I also want to just touch upon some cardiac general education stuff, because as people may know, my brother died of a heart attack in July. And, I want, especially people as they're getting into middle age, you should know that calcium scores can save lives. And a calcium score is a very quick CAT scan of the heart. I went to get mine at Radiology Associates of Ridgewood in New Jersey. I want to give them a plug because They have an ultra super low dose CAT scanner called a GE, General Electric VEO is the model. It's something like 90% less radiation than the competition. I didn't want to, irradiate my arteries. I just wanted to see if there was calcium there. And, knock wood, it was okay. And my surviving brother has a lot of calcium. And, and obviously runs in my family. And it's kind of hit or miss in people. And obviously there's risk factors, cholesterol and smoking. And you say, can chronic infections be a risk factor? Or antimicrobials, going to be beneficial, not beneficial? I think that there are things that people can do. One thing that, nobody likes to take my advice on this. I'm a vegetarian. I'm not a vegan. Vegans have, a lower risk of heart disease than people that eat animal products. And vegetarians have a lower risk. Vegans have a slight advantage over vegetarians, but I like pizza so much, I can't seem to get away from it. But, I just want people to know that vitamin K27 is a simple vitamin. If you're not on Coumadin, there's not many side effects. But vitamin K27, there's emerging data that it takes calcium out of the arteries and puts it back into the bones. So you get a double whammy good thing for people that are osteopenia, have osteopenia or osteoporosis, which so many women have and some men too as we get older.
That's great.
And, yeah.
That's a great tip.
Yeah.
Good job. Good job, Steve. Pick up lots of great knowledge and share it. And you never know, like, you say something like that, you're going to save somebody's life, and you won't even know it.
I hope I can. I mean,
You do. That's like your jam.
Somebody gave me a birthday card, a very, very nice birthday card, one of the nicest birthday cards I've ever gotten. It said, "You're like Johnny Appleseed. You keep spreading seeds around, and you don't even know that they're growing. But then you look back 10 years later, and look what happened from little seed."
I agree.
I thought that was nice.
That is true and nice.
So people say, this is a nice question about, what we like to do our SIBO dance, because we don't even know how to really pronounce it. But a small intestinal bowel overgrowth, is there a relationship to Bartonella? I mean, I see it in my patients. I haven't seen it necessarily be a Bartonella or another infection that's definitively causing it. But I think it does boil down to when there's motility issues in the GI tract. There can be pockets of abnormal growth, and bacteria can be picked up with these breath tests that are growing abnormally. And it is interesting that the most accepted, even though it's not approved for SIBO or SIBO, Xifaxan is a non-absorbed rifampin.
Right.
And it does suggest to me that maybe this is related to Bartonella, because rifampin obviously treats Bartonella. Does it hit Lyme? A little bit, very little, not a lot. And so I do have a suspicion of Bartonella in the GI tract.
And I think it's so fascinating how often GI doctors use it and don't really know. They don't really attribute it to an infection. Like, we want to reset the gut. From what? They don't. Yeah. There's no elaboration. It's the weirdest thing ever. But I look at it the way you do, where I think that's doing some good to kill some of those pathobionts.
Pathobionts, and we should just reinforce that term and just touch on it a little bit, because again, something people don't realize is that there's a very a black and white things of how we all look at life, I think, because it helps us structure our surroundings. Like, we like to, everything has to make sense, right? So we think you take antibiotics, it's going to wreck your microbiome, blah, blah, blah. Well, not all antibiotics are created equal. Some are relatively innocuous to the GI tract, where others are really, really horrible, and we have to be able to distinguish. And the other thing is that infections cause a disruption of the microbiome. People don't know this, that if you have a disturbed immune response, you have a disturbed microbiome. The immune system does a really finicky dance with the microbiome, because it keeps it like arm's length. You want to have the good things that we can get from the microbiome, but do not be fooled. If our immune system is not working properly, these friendly bacteria turn into monsters, and they can literally kill people, and they can cause disease. And that's what happens. So it is this feedback loop where the immune system is keeping the bacteria in a microbiome in check, in this perfect balance. And if somebody just has chronic infections, never touches antibiotics, I've seen this too many times to count, literally. I cannot count how many times I've people seen come in with years of illness, who have not taken antibiotics, who don't have a diagnosis, who have gone down various functional medicine and holistic routes, have had their microbiome mapped out, and it's a mess, and they've never been treated with anything.
Right.
And,
there's a lot of propaganda where antibiotic usage is concerned. People don't realize that 80% of antibiotic resistance comes from agriculture. It's fed to animals. It's even put in plants. It's also very hospital driven. People get these resistant infections in hospitals. They're not really being driven by Lyme doctors. It makes me crazy that patients are so unnecessarily scared off. If you're under a doctor who has a good plan, uses them wisely and as sparingly as they can, I don't really see.
Like Dana, if you look back on your treatment, how many antibiotic types do you think you took? Serious. I mean, I can remember your treatment plan. What?
3 or 4?
Even less.
Okay.
Right. You took Doxy and Tetra. You took Doxy before you saw me. Tetra. Took Zithromax.
Right. I took a little Sedfenir with somebody before.
But with under me, you took Tetra and Zithromax. Those are the only 2 antibiotics.
That's right.
And everything else was a non-antibiotic antimicrobial.
Right.
Like people.
Right.
So people don't realize that you can get a lot better. In your case, what, 99%? I don't know what percent you call yourself at. Yeah. Like without even taking many antibiotics, like really limiting any impact to the GI flora.
That's right. I had no problem at all, and I'm sad that people are so worried all the time about something that I think in a lot of cases doesn't ever happen.
And in my situation, I was so deathly ill. I mean, everybody thought I was going to die, and I took every antibiotic. I mean, I just made a decision. I'm going to take everything to get better. I'm not going to live my life as a disabled person.
Yeah.
I mean, and I'm going to survive and I'm going to get through this. And that's what I kept telling myself. And I just said, the disease is worse than the cure. Because so many times people tell me the cure is worse than the disease. I don't think so.
That's sad. That's a sad way to look at it, actually.
Yeah. Anyway, I just want people not to lose hope and stuff. So there are a lot of questions. It's true. Here's.
We need a moderator, so you don't have to be.
I know we talked about getting a moderator.
You get stressed out about the questions.
Well, let me just put up some nice comments too as they come in too, because people say nice things.
Oh, that's so nice. Hi, Amy Jo. That's really sweet.
Okay, this is
drunk. Just kidding. This is orange.
This is a nice question too. So if someone is MTHFR and needs MRI with contrast, possible TIA. I'm sorry to hear that. I hope things improve for you. What can be done to mitigate the issues from contrast? Or should contrast be automatic? No. I don't think MTHFR is an automatic no for contrast. The question is, talk to the doctor about, is contrast actually needed for, first of all, TIAs don't show up on MRIs. If a TIA is showing up on MRI, that means it's a stroke. That's the definition of a TIA, is that it's too short to cause damage. So, strokes show up on MRIs of the brain just fine without contrast. There actually are, in terms of the brain, very few indications for a contrast dye. Doctors a lot of times order them reflexively, and it's a pet peeve of mine, just like we all have our pet peeves, because I almost never order contrast. If somebody has a suspicion for something called an acoustic neuroma, which is usually a small, it's a tumor in the part of the ear nerve. Someone has vertigo or unilateral hearing loss, it grows along the lines of the nerve, and you can miss like 1/3 of them if you don't use contrast. Like there are certain things. If someone has metastatic cancer, obviously you need contrast to pick up, to looking for tiny little things, specks like the size of a grain of rice that you may miss otherwise. But to find, let's say, a tumor, to find a stroke, to find a demyelinating lesion, you typically don't need contrast. So somebody does find a tumor, God forbid, the contrast is very, very helpful in delineating what kind of tumor it is, benign versus not benign. But just picking up the initial lesion as a screening test, most of the time, gadolinium is not required. And gadolinium can stay in the body, particularly the brain, much longer than people realize. It does have oxidative qualities, which damage DNA. And people talk about taking NAC and glutathione and vitamin C and things like this that can help get rid of this kind of heavy metal quality that gadolinium has. And it may help. I'm not really sure if I've seen studies on it, but intuitively it makes sense.
Yeah.
And I would certainly take antioxidants before being exposed to gadolinium if it was a necessity. So this is some seeds, like Johnny Appleseed.
Yeah.
So okay. Okay. So This is from Julia. Thank you so much. It's very nice. It's nice to see you here, and I'm really we're so
Yay.
happy that you're
That's a
approved.
great story.
Yeah. Okay.
That's wonderful to hear.
Yep.
Glad you're doing great.
Oh, so many nice messages. Thank you, Justin. Thank you so much. Okay.
That's nice.
So, and then someone's asking, does Lyme damage show up in the MRI? A percentage of the time. It only shows up when there's people can see damage in a variety of ways. People would see it as sometimes like premature aging of the brain, like these things called microvascular disease, which everybody kind of gets as we get older. Sometimes you see this accelerated. Like I have a young guy that came to see me. And when I say young, I'm talking about when I saw him, I think he was in his late 40s.
Mm-hmm.
And, the radiologist starts to say, oh, late 40s, early 50s, you can see a couple little spots in the brain. And this guy had over 100. And clearly that's not normal. And a lot of these people have a mix of things. It's not just an infectious basis, but I look for homocysteine. High homocysteine, there's a lot of data that cause premature vascular aging. It's one of the risks for things like heart attacks and strokes and actual vascular dementia and some cancers. It's just not great to have. So, and it's easy to make it go down. So we look for that all the time. So Dana, we have to wrap up in around the 60-minute mark, and we're 51. Do you have anything we'd like to talk about before we just commented how we are really not for this kind of like post-COVID, vernacular, this post-acute sequela of COVID-2, PACS. We think it's idiotic, and it's going to be ultimately harmful, and it will not encourage investigation into the persistent causes of long-term COVID.
Yeah.
And
the other thing I want to talk about a little, if before we go, is some of the pushback that we get, some of the controversy that this book has caused, and I'm really glad about it because we have hit a nerve. We interviewed off the record 2 major pharma executives who told us the same thing. When you poke the bear, they don't like it. So the whole thing is, one of the big secrets of this topic is that when you cure disease, there's not that much money to be made. There's a lot of money in chronic incapacitating illness. There's a lot of money in psychiatric illness, ongoing psychiatric illness. So just to take my case for an example, briefly, the couple of things that I was diagnosed with were anxiety and depression. Okay, new onset anxiety, depression, insomnia. That's a couple of medications right there, probably for the rest of my life if I didn't find out it was an infection. Fibromyalgia. What do people take for fibromyalgia? I also had a lot of numbness and tingling, probably MS, was coming down the pike. So people that are diagnosed with a multitude of syndromes or symptoms at once, they get put on a lot of drugs that just treat the symptoms, and they're really hard to get off of. I know because I've heard from thousands of patients over the last 5 years who have all told me the same thing. I was in the lucky category that saw the bite and knew that it was, I had to attribute it to this bite that I got on my shoulder. Most people don't see the bite. So there's a lot of money in keeping people sick, and there's not a lot of money in curing disease. If you cure these syndromes, MS, fibro, lupus, whatever, anxiety, depression,
in my case, rheumatoid arthritis and spondylitis. And you won't give me a biologic immune suppressants for TNF alpha inhibitors. There's a comment from, let me scroll back here about James Osborne, that ivermectin is not, he knows, because we heard about these 4 patients, because Danny, you know them too, that the same situation, ivermectin does not always prevent COVID, which is absolutely true. There is no single magic bullet. People, I would not place all your eggs in any basket. These are situations in motion, and everyone's an individual, and an ivermectin will completely fail some patients, and it will completely save others. And I don't want to paint it as the miracle, but it is semi-miraculous because it is cheap, easy, and safe, and it does help the majority of patients that take it, and the studies support that, but it does not help everyone, and it's not going to save everyone. And I don't think I would be comfortable on ivermectin, let's say, riding New York City subways all day without a mask. Absolutely. Somebody said, I'm going to give you $20 million to ride New York City. I'd be, no, No
Absolutely.
way. I'm not going to ride the subways on ivermectin.
Well, one of the things that, so James and I have been going back and forth, and, I've shared his messages with you. And one of the things he told me that was really interesting, and James, if you want to comment more while we're here or whatever, please do, is that the patients that including yourself, who were on ivermectin and got COVID, it didn't enter the lungs. I have to think that's still good. I mean, I don't think it's a panacea either. And I've been telling people from the beginning, a lot of people get angry with me because I won't give my full on, this is going to get everybody out of the woods. I think it's a great tool.
A great tool.
I take it when I feel like I've been exposed. I had a handyman here on Monday. He was in the house for 10 hours. And even though I wasn't in the house, I came in after. I know a lot about aerosols and about the nature of airborne viruses now, more than I ever thought or wanted to know. And so to be safe, even though I waited almost an hour, these things can stay airborne for hours and hours and hours, and even a day, even a full day. So I took ivermectin, and I will continue to do that when I feel like I'm at risk, but I do not think it's a panacea.
And look at my dad's situation. So my dad was in the nursing home last winter when 20% of the nursing home died, and I saw that death was looming for so many people in that nursing home. I spoke to his doctor. His doctor put him on Zithromax and hydroxychloroquine, which is Plaquenil, prophylactically, because that was one of his best treatments way back in the Lyme days when he had heart failure.
Mm-hmm.
He was on it for 3 months at the time that COVID ravaged the nursing home.
Mm-hmm.
And for people that follow us, I've told this story before. So 20% of the people in nursing home died from COVID. Another roughly 20% of the people got COVID really severely, many of them in the hospital, and survived. And they tested everybody in the nursing home. My dad got COVID. He was PCR positive. I thought it had no symptoms on these medicines, but still got the infection. And then I thought maybe it's a false positive. 2 weeks later, he was negative. We started my ivermectin at that time. When he was positive, we had ivermectin plus Zithromax plus Plaquenil. And 2 weeks later, his PCR was negative. And then a couple weeks after that, his COVID antibody was positive. And I called up the nurse because they tested everybody in the nursing home for COVID. And I said, who else was asymptomatic positive? I was curious about the rates in elderly, frail people in a nursing home. She's like, nobody. Your dad was the only one. Because people are like, oh, maybe he just had, it's so common to have asymptomatic COVID in the population.
Yeah.
Not in 90-year-old sick people in a nursing home. They don't get asymptomatic COVID, but my dad did. And I think, I believe these medicines saved his life. He has many, many risk factors. And I don't think he would have done well at all. And I credit them with saving his life. So
I agree with you.
I think, but I wouldn't put it all in the ivermectin bandwagon. I wouldn't put it all in hydroxychloroquine or Zithromax. I think it takes a village, So we're so appreciative of everybody tuning in tonight and just spending time with us because your time is valuable. And your comments are amazing. They're all such good questions as always. And I would love to be able to spend hours and hours and hours, but there's only a little bit of a limit to our respective energy and time. But we just wanted to share some thoughts and some time with you tonight. And
a really rough and exhausting week. I mean, we'll come back maybe next week. My dog's been sick all week. You've had a billion patients and a billion things. So let's try to do this in the next week or two again.
Absolutely.
Yeah.
Absolutely.
And we love your questions, your comments. Please keep sharing the book with your friends and loved ones, and please keep sending us questions and comments about the book because we love hearing it and we love to see your pictures. One of your patients sent me a picture with her gorgeous new bathroom. She knows who she is. I'm not going to call her out, even though she did it publicly. With her whole new renovated bathroom and this
that's so nice
spa-like tub, and the book was right in the center. And she's showing her house, and she said, did I send you this note? She said, I'm showing the house, and the book is like the centerpiece of the bathroom, middle of this gorgeous new spa tub. And I was like, that is so cool. I love it.
That is funny. Yeah.
I live for this stuff.
Yeah, that's cool. Yeah. No, he didn't send me that. Can you send me that? I don't. How come I didn't get that note?
Well, it was a private message. It was a private message to me, but I will.
That's nice.
I will send it to you, but it was real. And she also posted it someplace on Facebook. But I'll send it to you.
Okay. So please continue to post pictures of if you like COVID by the bathtub when you're eating, COVID by your kitchen table when you're having a muffin or a piece of fruit in the morning. What did you say? Oh, chronic. Sorry. There's a Freudian slip. Chronic. Yeah. So take pictures of the book and spread the word if you can. And that would be appreciated. And I think people would appreciate it as well. So anyway,
Thank you.
thank you all, and have a good night, and we'll see you again in a week or two.
Yeah,
Okay.
great.
Bye, everybody. Thanks.
Bye.
Bye.
Thanks.